We are gathered. Thank you everyone for joining us. Welcome to Venice Family Clinic's Health and Justice series. This is the first in the series, and it focuses on homelessness and housing. And at the end of this discussion, if you would like to make a donation to 3 charities that Venice Family Clinic is helping sponsor, you can do so through a link that will show up in the chat box later. So I'm going to introduce our panelists. Liz Forer has served as Venice Family Clinic's CEO and Executive Director for over 25 years. She grew the clinic from 1 site serving 10,000 people to 14 sites serving nearly 28,000 patients, and guided the clinic in creation of new clinical programs and a network of over 200 community partnerships. Through her numerous board positions and advocacy work, she has championed legislation and policy to help low-income and homeless people access healthcare. Chancela Al-Mansour joined the Housing Rights Center over 10 years ago after having been involved in housing advocacy for 18 years. For 16 years, she worked at Neighborhood Legal Services of Los Angeles County as a directing attorney, supervising, and staff attorney in the housing unit. She supervised homeless prevention work with LA City and LA County and has litigated hundreds of cases involving landlord-tenant, housing element, mortgage fraud, and fair housing laws. And she has extensive experience litigating fair housing cases. John Maceri is the CEO of The People Concern and board chair of the Santa Monica Bay Area Human Relations Council and board member of NoHo Home Alliance. He previously served as board member, vice president, and 2-term president of the Business Alliance of Los Angeles. He is a past chair of the Westside Shelter and Hunger Coalition and also served as a member of the board of the Santa Monica Chamber of Commerce. You guys are busy. I am your moderator. I am an editorial board member of the Los Angeles Times, and for the editorial board, I write about homelessness. So welcome everyone. I'm so glad you all are here in a kind of cyber way. So Liz, let me just start with you about this. Homelessness is so huge. We could talk all day about it and about how we deal with it and try to make a dent in it. But interestingly now, it's always been a public health crisis, but people living on the streets in cold and heat without access to bathroom facilities. Now COVID has come along with the real possibility that it could ravage the homeless community, which has no way to shelter inside. Let me just give you some statistics. In a county of 66,000 homeless people, there have been 1,016 positive cases as of yesterday of COVID among the homeless population, and there have been 26 fatalities. Liz, what has LA County done right during the pandemic to help homeless people, and what have they not gotten right?
I'm pleased to say that the county has done a lot right during this situation. Our homeless clients are benefiting from a key thing that the county did, which they have not done for a very long time, and that is to truly treat homelessness like it is a crisis, meaning to pull out all the stops and to get things moving and to provide housing. So they have provided housing through quarantine and isolation for people who have symptoms of COVID and are waiting for testing, for people who have tested positive who are homeless. They have created Project Room Key sites using hotel rooms and renting hotel rooms so that people who are viewed as the most vulnerable, people over 65, people with multiple chronic diseases, people with something that might cause them to be more apt to get COVID, get Project Room Key sites. They have opened up shelters. They're looking at possibly doing some type of camping or encampment that will be something that can work. We're hoping to test it on the west side. They have approached us quickly about, we'd spent 3 or 4 years at Venice Family Clinic working with neighborhood not-for-profits and homeless people in our community to get a toilet up that was attended 24 hours a day. And within literally milliseconds of COVID hitting, the toilet and hand wash station and showers that we'd wanted on 3rd Avenue were up and running. So they're recognizing that these things have to be available to people who are living outdoors, and that it's critical for keeping them healthy. And then I think with that, those are the main things. What have they not done? I think some of the things they're having trouble with are where we're having trouble everywhere. We didn't have enough testing at first. We were doing fine with testing a month ago. With this surge in the county, we're back to 7-day turnarounds on tests, which basically make them useless because you might as well just quarantine and isolate. Why bother at that point? But that is a problem that you're seeing nationwide, and it's because we don't have a national policy, or we didn't set up nationally the supply lines we needed to not have this problem now. So those are not strictly county issues. I think the key thing that the county needs to do now is to figure out how to make sure everybody that's been housed now never goes back to the streets after the hotel rooms are no longer available.
And I want to get to that in a minute, but let me just ask John, because your social service organization, which has provided so much help to so many different homeless people in different housing situations, is now running some of the hotels in Project Roomkey. And let me just say, Project Roomkey is a program by which the county and the city of LA lease motel rooms and hotel rooms, and which are empty, and they house, because of the pandemic, and house homeless people in them. And there are 4,000 homeless people in the county who are now in hotel and motel rooms. And John, I think the people concerned is providing services at 2 of the hotels?
Yes, that's correct. So currently we operate 2 Project Roomkey sites, both in Koreatown, 48 units in each one. And I agree with everything that Liz has said. And I think from the kind of what's next perspective, all of those sites, not just the ones that we operate, but with our colleagues around the county, we're all pivoting now to moving those folks into permanent housing situations. So that will really be the focus, going forward. The Project Roomkey sites they kind of have staggered renewals. So some of them will be up and running longer than others. But the goal ultimately, as Liz said, is to make sure that none of the residents in Project Roomkey return to the streets, because these are the most vulnerable, the highest acuity folks who really need to be in permanent housing. So that's going to be our focus, certainly, going forward. We're already starting to pivot. We started to move individuals into permanent units. We have, in one of our sites, we have about 36 people actually matched to housing vouchers. So we're in active search of permanent units for them. And we'll continue that with both sites.
And we'll get back to that too in a minute, but Chancela, you were on 2 really important committees that LAHSA, the Los Angeles Homeless Services Authority, sort of spearheaded or created. One of them was a committee that looked at women in homelessness and their different experiences being homeless. And the other was a committee on Black people experiencing homelessness. Black people are comprise roughly 9%, maybe a little lower, of LA County's population, but they are about 33% of the homeless population. Has homelessness continued to affect those populations differently during the pandemic? Do we see women and Black people in particular suffering more if they're homeless during the pandemic, or is the pandemic an equal opportunity horror?
Mm-hmm. Well, unfortunately, we don't know a lot yet. A lot of the statistics aren't out yet in terms of the overall impact and the lasting impact and we're just talking about the illness of the COVID-19 illness. We're not talking about all the other, all the other tangential ways in which Black people are going and Latinx people are going to have suffered more so because of loss of income or family disparities, family issues, and so forth. But yes, in terms of, at least in terms of those who have passed away so far, over 50%, of those are Latinx, of that 1,000 people that you've mentioned, those people who have lost their lives.
Of the 26 deaths, I think it was 26 deaths, half of those are Latinx?
No, I'm sorry, I'm referring to the number of those people who have tested.
Oh, the cases. Okay.
Yeah, of the cases of COVID-19, of the 1,050, I want to say, of those who have tested positive within, who are also experiencing homelessness, about 50% are Latinx. The number of Blacks, from what I understand, are relatively low compared to the other statistics we've seen, between 15 and 20%. So, but still, obviously, there's a lot more information that we need in terms of how COVID-19 is impacting our community. There's a great fear that people are suffering in silence, possibly, and where they are trying to live, where they're trying to exist, or because of other health issues. The COVID-19 health issues is not necessarily the one that's presenting itself as being the one issue, because there's so many other health issues that impact, especially for women, and especially for Blacks. And then if you compound those issues, if you compound the issues of people who are Black, transgender, persons with disabilities, or seniors also experiencing homelessness, on top of all that, the health issues are just so insurmountable to some degree that it's hard to even think about, to wrap your head around. I just want to give an example. Last year, they looked at life expectancy data, and they looked at life expectancy rates in Palos Verdes and La Canada Flint Ridge, predominantly white communities, where the life expectancy is close to 89 years old. And then they looked at the life expectancy in Compton and in South LA, where the life expectancy is 75 years old. So 13, 14 years within, a 10 to 14 mile area within the same county. And that 75, and actually for Black men in Compton, it was closer to about 68 years old is the life expectancy. So it's much lower than even the average in Compton right now for Black men. So again, this is pre-COVID. This is already, all the issues. Hopefully we'll get a little bit of time to dive into in terms of why these communities are so much more vulnerable already to what we've been seeing with COVID-19.
And I mean, it is interesting that the one thing that the Homeless Services Authority tried to do at the start of the pandemic was to look for the populations on the street that are most vulnerable. You're vulnerable if you're living on the street, but but there is a most vulnerable population, and that is people who are 65 or older, or who have an underlying medical condition. And those are some of the folks that LA, that LASA has been trying to house. So to get back to something that Liz and John were both talking about, the 4,000, more than that, they're probably, because there are 4,000 people in hotels and motel rooms, and then there are also another 1,000 people who've been sheltered in rec centers in the city that have been turned into temporary shelters. Somehow 5,000 homeless people have managed to be taken off the streets and put into hotel rooms, motel rooms, shelter beds. And the idea that the city or the county may have to at one point return those motel and hotel rooms back to their owners, return the rec centers back to the city, the last thing that the city and the county want is to say, okay, everybody back to the streets. So how do we prevent that? And anyone?
Well, I think there are a couple of things that specific to Project Room Key. This is a moment in time where we're going to have to harness the housing stock that is available. So for instance, and I'm not suggesting in any way that there's ample housing stock. We know that one of the reasons we have, a homelessness crisis is because we've had a housing crisis in Los Angeles for decades. So we should have no illusions that magically 15,000 housing units are going to appear. That being said, I can tell you that within the last 2 weeks, a group of homeless service providers across the county did an inventory by city council district. We didn't even look at the county, and identified about 3,600 potentially available units that would be, now this is a combination of units that are coming online in project-based developments that are funded through Measure H that are leasing up this year. A lot of scattered site units. So there are a lot of private landlords in multifamily that own multifamily properties throughout the county that have vacant units that are available. So we did a very quick survey, and we're able to identify, as I said, approximately well over 3,000 units that are available. So we're going to have to really harness all of those units. I think there will be a need for some kind of expansion of the interim housing facilities as well, temporarily, to bridge the gap for the lack of available permanent units we have. And then we're going to have to really turn our attention to the scalability and sustainability of housing production, which of course has been talked about for a long time. But I think this gives us an opportunity to really look at the current financing models and construction models so that we can accelerate those processes, because everything is going to have to be streamlined, from identifying sites to actual construction costs to how we finance deals to permitting, construction. All of that is going to have to be ramped up significantly. So if we can do all of those things, I think we have a good chance at rehousing the people that we have in Project Roomkey. Beyond that, of course, there are going to be thousands more people that are going to need to be housed, but the same principles can be applied.
What I would add to what John has to say is, when he talked about streamlining things, when the '94 earthquake hit, a highway bridge fell down and the process was streamlined so that highway was back up and running within a very brief amount of time. If homelessness is truly a crisis, we need to streamline the building codes. We need to streamline the permit process. We need to say, we're building here. We will make sure that the building is set up in a way that is safe and meets certain codes, but it needs to go up and we need to move it along. It can't just take endless amounts of inspectors coming out and waiting and waiting and waiting. And that's critical. I would add that let's recognize that someone who lives on the street, their average lifespan is 48 years. And when you think of how staggering that is, and it's because we have not had in California and in Los Angeles and even across our nation, a housing policy that truly looks at how do we house everyone? How do we make housing a right and not a privilege? We've made it acceptable since 1980. When you have people unhoused for that long, people get accustomed to seeing people without housing. It's become acceptable. If we would say that it's unacceptable, we would house everyone. I'm hopeful that some of the hotels, not from a business standpoint, I'm sad that they may not reopen, but I'm hopeful that we could also use some of those in a way that they could be purchased and used in a long-term way. So I turn it over to Chancela and John and to you, Carla.
I just wanted to build on something that Liz mentioned. You gave a great example during the Northbridge earthquake when I first came to LA and first started working, and how quickly they rebuilt the 14 freeway, that bridge. Another example that I have, a more recent one, are the businesses that have been allowed to expand into our streets in Pasadena and other parts, in order to help them economically and provide outdoor dining. And this is in the aftermath of the horrific incidents we've had in Santa Monica, where a man ran over and killed several people in a farmer's market and so forth. Like, it's not safe necessarily to have people sitting and dining and on our streets. But hey, they quickly, they recognize that this is a need, quickly turned around, forget, those safety concerns you're talking about, Liz, let's fast track it in order to provide for that economy. So again, if we're why not look at these solutions, because we're in a last resort, urgent crisis type of situation.
I completely agree with all this. If there were people from the city government on this call, they'd say, we are streamlining it, but it's obviously not streamlined enough. What about the possibility of people always talk about more innovative housing. What do you think about these kinds of shipping container housing projects? And what do you think about tiny houses, which are really not much more than garden sheds, but they do have doors? Is that doable?
Well,
No.
I think in terms of housing types, you referenced shipping containers. I mean, we've been involved with the development partner Flyaway Homes for the last several years. It actually grew out of our organization as we looked at, because frankly, I've been beating the drum of, faster and cheaper. And I don't mean cheaper in terms of quality, but we're never going to get to scale if we continue to plod along in the current format of construction. And so it's not the only mechanism. I mean, shipping containers, modulars, even, stick built, but there are technologies that are emerging that actually could be applied. The challenge you have, of course, is always finding land and where you're going to site the programs. And the same is true for tiny houses, is that, you need available land. And certainly we've seen tiny houses work in various parts of the country. They're used in the Pacific Northwest quite a bit. There's tiny house villages in Texas. I mean, they've been used in other parts of the country, very effectively. And I would say that I don't subscribe to the philosophy that one size fits all, that there's only one solution to our housing crisis. There are multiple solutions: adaptive reuse of buildings, hotels, motels that don't displace currently housed people. I think that's important, that we're not creating, new housing at the expense of people who are currently housed. But I think that there are lots of technologies that are emerging now. Certainly modular is becoming more popular. The challenge is we don't have a local source yet that can scale to the level that we need them to. But I think it's out there. And if we would really lean into this in a way that we haven't before, we really could get production going.
Chancela, does all this housing fit your picture of what people should live in? And I apologize if I sort of denigrated, or I hope I didn't denigrate shipping container housing, because actually it's very legitimate housing. It looks very attractive. It's just built in a faster way. Tiny houses really are kind of very, very rudimentary and generally don't have indoor plumbing, which I believe all permanent housing should have. But if we're thinking about having to move people into shelters once they leave motels, I think sometimes maybe we should just move them into tiny houses. But does that meet your criteria for suitable housing?
So, like John, I also my first thought went to the land ownership, who would own the land and so forth. And I, as a fair housing advocate, I think of this sometimes in terms of the policies and the rules, in terms of who gets to, how housing is divided, how land is zoned, how land use ordinances are done that may relate. So, for example, City of Pasadena years ago finally passed an ADU law allowing single-family zone homes to build an accessory dwelling unit on formerly known as granny flats on site. Northwest Pasadena at the time, predominantly Black, right next to Rose Bowl area, predominantly high-income white. Right next to one another because of redlining from years ago. It was how it was carved out. So the Blacks could only live in Northwest Pasadena, Jackie Robinson's mother, so forth. That was a maid, owned a really small bungalow home. So there was black home ownership right next to white home ownership. But the property sizes were less than 10,000 square feet on average, whereas the white property sizes were greater. City of Pasadena, when it passes law, of course, set the barrier at only properties with the lot size of more than 10,000 square feet could build a second lot on their property. This meant that elderly and aging Black homeowners in Northwest Pasadena couldn't build that second dwelling unit to allow a caregiver to live there, or their adult child who maybe was experiencing homelessness or who was formerly incarcerated, who need to come back and to have a place to live in order to have a rental property that would help their income so that they wouldn't have to sell because they had outstanding medical bills. And so for them, what happens when Black families sell in Northwest Pasadena? It doesn't go to other Black families or even or Latinx families as well.
Because they're so expensive now, and
because it's so expensive, because the home values have changed so dramatically. The school board of Pasadena has seen the Latinx school enrollment go down every year for like the past 15 years.
Mhm.
Families can't afford to stay in that area, and Pasadena are being pushed further and further east or north or wherever, and so forth. So so in terms of when I look at the type of housing, that's the first thing I look at in terms of to make sure that if there is zoning to permit that type of thing, to make sure that it's applied equally and that it doesn't keep out communities of color, and so forth, to allow them to even engage into these like kind of different ways in which to create land, because again, going back to trying to keep some Black homeownership in the Black community is essential to the Black homelessness rate, as well. There is a link between when grandmother dies and family has to sell that home and nobody can afford to buy each other out and so forth. There's not that village, there's not that home, there's not that place for everybody to go back to in LA anymore, because you're spread out between Palmdale and Pomona, and San Pedro and so forth. And if you're lucky to stay in LA County at all anymore. And so those are kind of the more reasons I see. And then secondly, I just want to throw out there, my only other issue about that kind of tiny housing is whether or not it basically doesn't provide housing for families with children. And it doesn't provide housing for seniors and persons with disabilities who may need a caregiver, who may need that extra room for reasonable accommodation purposes, for their equipment and so forth.
Jumping in, one of the things that concerns me, the type of housing is important, but one of the things that we were talking a bit about before we started was the importance of preventing people from becoming homeless. If we could just keep people in their housing, you wouldn't see the rates going up so quickly. And with COVID now and the way people are getting behind on their rents, we could see a huge wave of homeless families and other people becoming homeless when the laws start to shift back and allowing evictions for lack of payment of rent. So there's got to be something to mitigate this time for people who have not been able to pay their rents, to keep them in their housing, or will never, ever have a chance at catching up and providing the housing to the people who are currently homeless.
And I agree with you, but how do we do that? Do we just have an eviction moratorium that goes on through next year?
Well, one way to do that are eviction. So
I don't have a good solution, so I'm glad you jumped in.
there is a campaign that's been afoot pre-COVID-19 of housing advocates nationally, on a national level, but in Los Angeles as well. And that's the Right to Counsel campaign. And it's a tri-level campaign. One is to provide education and outreach to tenants to try to do that prevention, to try to educate them about their rights. So hopefully to avoid evictions, and also to do some enforcement as well, to provide attorneys, to provide eviction defense. Thousands of people get evicted every year because they don't have legal representation in court and they lose. The bargaining power is against them. Landlords have attorneys. Oftentimes judges don't allow them to even speak or really present their case, and so forth. So preventing evictions is key, and that as well. And it's not just, and rental assistance is as well. Rental assistance is very important, but all those things won't work unless you have everything in place.
Yeah.
The legal assistance, the rental assistance, and the education and outreach to inform tenants what their rights are.
And I've been thinking about the fact that, we're saying so much about keeping people in their houses or keeping homeless people in whatever kind of temporary housing they're in now, or getting them into some other kind of permanent housing. There are still, even if there are 5,000 or 6,000 homeless people in the temporary housing that we provided for them through the pandemic, that still leaves another 60,000 who are on the streets. And I'm just wondering, what's their situation like? I mean, the city council just passed a motion yesterday that seems to allow the city to go back to deep cleaning some of these sidewalks where people have put their tents, which means they can tell people to move their tents, which violates CDC guidance on homeless people during a pandemic. The rule is, or the guidance is, let people stay where they are, because if you ask them to move, you make them even more vulnerable to getting infection. I mean, John, your folks must be doing outreach to people who are still on the street. In fact, I know you are. What's the situation like out there?
Well, it's pretty dire in terms of people's access now, because when you think about people experiencing homelessness, the closing of public spaces like libraries, for instance, or coffee shops or restrooms where they could go in and sort of meet their basic hygiene needs are no longer available to them. So like at our access center, we operate an access center in Santa Monica. We've seen a doubling of the number of people. And that's not necessarily a double the number of people who have become homeless. It's people who are already on the streets whose options have become diminished. And so, and that's taking place across the city. We see it in Skid Row. We see it because we work all over the county, but certainly in areas where we're doing outreach, we're seeing the access to basic needs really being diminished. I think the challenge, going forward is as you described, Carla, the sweeps now are really not going to be effective and really present a public health crisis, or making the public health crisis worse. And it's really endangering the lives of people experiencing homelessness as well as the broader community if you're dispersing people. So I think we have to dial back on that for now and try and find ways actually of increasing folks' access to basic hygiene needs. So, portable toilets, restroom facilities, trash pickup, those kinds of things where people can, manage their living situation in a different way while they're still on the streets is going to be far more effective and impactful for them and for the broader community than creating, a diaspora of folks who potentially would become sick.
What do you see, Liz, out on the streets these days?
Well, often the type of cleaning that was prescribed by the city council yesterday is often meted out as punishment. So if it's 6:00 a.m. when the tent's supposed to be down and someone shows up at 5:55 a.m. and that homeless person is doing everything they can as fast as they can to get their tent down and get their stuff taken away, oftentimes the people coming to do the cleaning simply say time's up, and they take all of that, the tent, the sleeping bag, their prescriptions, their eyeglasses sometimes are in there, leaving the person far worse off than they were before the cleaning happened. There's been a lot of work to mitigate that type of occurrence, but it still continues to happen. There's supposed to be signs posted well in advance, and people are supposed to be told where else they can go well in advance, and people are supposed to be given the time to get their things together. But time and time again, we see at our clinic people coming in for their medications that were lost because a sweep happened that they weren't notified of, coming in needing their new eyeglasses. One gentleman mentioned to me that he had a particular kind of clippers that shaved his beard and neck, and a really nice shirt that he always kept for job interviews. And he said, that's all gone. Now I'm starting from scratch and I have an interview next week. So there's 1,000 little ways that we could do the cleaning in a way that might engage the community. I've seen it done where groups hand out trash bags and everyone works together to clean. I also know that sometimes in Venice, the garbage truck pulls up to a huge pile of garbage that our homeless neighbors have carefully put together so it could get picked up, and simply refuse to pick it up. They sit for 20 minutes. The little timer goes off that shows they've, supposed to have gotten their load, and they drive away without it. So there's weird things that happen from individuals. Not all sanitation does that, some do. Not all police give homeless people a hard time, some do. But when you're trying to engage people on the street and they need our trust, it's really hard when others come along that are unreliable, that may be part of a governmental service. And building that trust with them is what helps us get them into housing and off the street. Building that trust with them allows us to be able to say, yes, you can quarantine in your tent, but if they come across to clean everything, it's really hard to quarantine. So these are the difficulties. So doing this in the middle of COVID is just not a good idea. Better off putting up more showers, more hand washing, more attended toilets, and making sure that people have the tools, brooms and plastic bags for garbage so that they can do their cleaning on the street, which I've observed time after time people doing.
That's a really good point. We're going to have to go to questions pretty soon, but I wanted to ask you all, what is it that people, the public, can do to help homeless people, to help this situation? And is one thing they can do to simply stop protesting housing for homeless people? So,
I actually was thinking when Liz was speaking, Liz elicits a lot of thoughts in my head, and I appreciate that very much. But there's in South LA, there's a county program in which they have a rotating shower system, and they're partnering with churches and faiths, or trying to partner with faith organizations to host these showers and so forth, and in their parking lots and so forth, and during a time when the community's there and engaged. And it's had some challenges because there hasn't, unfortunately, with some of the places, there has been community engagement with those persons experiencing homelessness who are there to use the showers. And some others, there isn't community engagement at all as well. And, you know, we think it goes from everything from the leadership of these faith-based organizations to set the example and so forth of sitting. I mean, and COVID-19, it's very different now. Before we were going to say to sit at the table and share bread with somebody and so forth, and talk to them about their day and their life and incorporate them more into our daily lives. And unfortunately, with COVID-19, a lot of my answers to your question are a little bit different than it would have been, in terms of just getting to know somebody, talking, you know, realizing that most people who are experiencing homelessness are your neighbors. They grew up in your neighborhood. You know, Pacoima, for example, who live underneath the 180 freeway, who are primarily Black, all grew up in the Pacoima area, and their families actually owned homes and so forth in the Pacoima area, where it was, you know, set apart because of redlining back in the 1930s for Black people. Anyway, but and it happens everywhere. That I think if people really reached out to people and just had a conversation, even of how you're doing with somebody, they would realize that they really are our neighbors and our family and our community.
Yeah, I mean, I absolutely agree with that. I think the human connection and the opportunity to get to know people and their stories is important, and it changes hearts and minds when you have that experience of understanding a person's story. I would say on sort of a global level, we have to, I think, as a society, decide what we're going to be mad about, because, you know, the same people who show up at community meetings or council meetings and complain and, you know, scream loudly about building affordable housing or permanent supportive housing are the very same people that show up and complain about people living on their streets. And so you can't have it both ways. You know, we either have to house people. If you don't want people on the streets, the solution to homelessness is housing. It's really that simple. And that's true in every community, you know, across this county. And so people have to decide, you know, do you want to yell about folks living on your corner or on your block or, you know, somewhere in your business district, or do you want them housed inside? And there is plenty of evidence that affordable housing and permanent supportive housing does not destroy property values. It doesn't ruin neighborhoods. It doesn't do all the terrible things that people say that it does. And so we have to have a paradigm shift, you know, significantly, because we talk about the scalability and sustainability of housing, but that's only going to happen if the housing actually gets built. And as long as you have communities, you know, that essentially have the veto power because they yell the loudest, that's going to be a problem. And I'll just, you know, my anecdote is that, you know, I think that when you have, you know, folks who can show up and scream the loudest to, you know, stop an affordable or permanent supportive housing, you know, project, that when we reward that kind of behavior, basically what we're saying to every community is, if you behave like that, then you can stop housing production. Yeah. So at some point, something's got to give, because we are, you know, we're 66,000 and climbing, and there's a tsunami coming, you know, with when the eviction and moratoria are lifted, not just in Los Angeles, but across this country, there's a day of reckoning coming. And we're going to have a lot more people that are going to potentially be facing losing their housing. So I think we have to get real about what it's going to take to turn the tide. And part of that is going to have to be neighborhood resistance is going to have to be diminished.
I would add that observing, especially in Venice, which is a neighborhood that's gentrified since I arrived, the fact that there's really quite a bit of property in Venice that is public property that could become housing. And if people in Venice would just recognize that they could still have a wonderful life in Venice, and they'd have a lot less people living on the streets if they'd allow those areas to be developed. That really nothing will change in terms of their quality of life if people are allowed that housing. In fact, the opposite. They won't have to worry about cleaning their alleys as much, or be concerned about someone living behind them, when they, kind of crawling into a garage space at night. Instead, they will know that they have created a system of affordable housing. It doesn't make sense to think that every neighborhood has to be chopped up based on the economic capability of each person, so that wealthy is a wealthy neighborhood, poor is a poor neighborhood. If you had a whole range of economic people from rich to poor to the middle living in their housing units, I think you'd see us flourish in a way that we're learning to do under COVID by just all of us having a little bit more time to be at home. It's the same type of thing. People would flourish in their neighborhoods.
That's so interesting. And in fact, I have to go to questions, but I just have to share this. I mean, historically, before there was less segregation than there is now, Black communities were like that. It was a mix of working class, well-to-do, middle-class people, and they melded as a community. I grew up in a community like that, where there was the lawyer who lived next door and the retired postman who lived down the street, and it was actually really wonderful. Let me go to questions. There are about 42 of them, so I don't think we'll have, and I apologize, we're not gonna have time, obviously, to get to all of them, but this one kind of struck me. I sometimes come across people who are in terrible condition and incapable of taking care of themselves, especially women. In some cases, they have been abused in addition to being mentally ill, or perhaps. What can I do in that situation? Doing nothing feels horrible.
So one thing that you can do is make a referral through the LA Hop line, which is a countywide referral system. And if you can provide the information of where that person is, then an outreach team will be assigned to go out and make contact with that individual and offer assistance. So that's probably the most immediate thing that people could do.
Are you talking about 211?
No, there's 211 and there's LA Hop, which
Hop.
is LA Hop, which is the referral line that is countywide. So 211 is also an option, but frankly, 211 isn't just focused on people experiencing homelessness. LA Hop is more specific and targeted to outreach teams that are covering specific geographic areas all over Los Angeles County.
And I would add, if you call LA Hop, keep walking by to see if that person's still there, and keep calling, because they get on it. The squeaky wheel gets the grease, and LA Hop does show up. But in the case of the type of person you described, that is a person that may have been on the street because of their mental health, and then now the trauma they've experienced on the street has caused it to even worsen. So they really need help. They need mental health care and health care and housing.
Yeah, it's as companies realize workers can work more from home post-pandemic, is it realistic to think some commercial real estate could be efficiently converted to dorm-like housing, perhaps with shared bathrooms and kitchens? Does that make sense? John, could that work?
Well, perhaps. I think, and frankly, post-COVID, that we're moving away from dorm-like housing or congregate housing. That doesn't mean it's going to be eliminated completely. What it does mean is the number of people will be housing in congregate situations is going to be depressed. It needs to be in order to practice social distancing and good infection, control. So what I would say is that as I said earlier, I don't think that one size fits all and one housing solution is not going to work for everyone. We're going to certainly need some interim, bridge, emergency, however you want to describe it, some place for people to move from the streets while they're waiting to go into permanent housing. But I don't think we should emphasize putting up a lot of large dormitory style, facilities. One, because we don't want people to be warehoused for a long period of time. Two, because I think it takes the emphasis off moving people into permanent solutions. And three, because of what we've learned, during COVID and coming out of COVID is that is not an ideal housing situation for
Right.
folks.
Isn't the mental health issue part of the difficulty of getting people off the streets? Why isn't there a way for the mentally ill to be treated and cared for in a hospital setting?
So I'll take that one if you don't mind. In the 1980s, essentially the mental hospitals were closed and there were supposed to be community mental health centers that were to be built to help people with mental health issues. None of that came to pass, and it really caused the big spike in homelessness that you see. We need more mental health care. We have the capability of doing that. Our street medicine teams actually have psychiatrists now that go out with them, and we do administer antipsychotic injections in the field that are extraordinarily helpful to the clients. But to really have a stable mental health situation, especially after it's been clear that you have mental health issues, living on the street is not a way to get there. And so it's really critical that we somehow look at our mental health system and determine when someone needs to be hospitalized. The number of hospital beds for mental health has been shrinking over the years. So we really need to look at what do we need to be our mental health center of the future, because the present one really doesn't exist in any kind of systematic way that works for most people.
Will the new ADU code changes in some LA County cities help solve the homelessness crisis, or is that more of a stopgap for lack of housing stock? I mean, Chancela, you kind of talked a little bit about that. Do you think ADUs can actually make a dent in homelessness?
Like I said before, if it's to me, yes. But from my personal example, it has to be tied to existing Black home ownership. It has to be tied to community. I mean, let's face it, when it comes to renting to Black people, there's lots of discrimination, lots of race-based discrimination in housing. And Black landlords are less likely to discriminate. Not to say that they're is perfect by any means, but to some degree are historically and statistically less likely to discriminate. Oftentimes, we have Black families who, especially, they finally get a Section 8 voucher, or it could be a single person who finally gets their Section 8 voucher. And even though the law now says that an owner can not refuse a Section 8 voucher, they still are refusing and turning down Section 8 vouchers, especially if it's from presented by a Black person. We were assisting a 60-year-old Black woman in South LA. She was fine. She was thriving in her community, lived in her same building for 15 years with Section 8. New owner decided to get rid of all the Section 8 tenancies. So we assisted her in being able to get a new Section 8 voucher to move, but nobody would rent to her. And then, and also the rents were so high, and the housing authority wouldn't meet the payment standard level because the rents were so high. So she found herself in her car. And then the next time I saw her, she had been raped. Her car had been impounded because of parking tickets. And then the next time she was able to make to my office to see me again, she was in a much worse mental health issue because all her paperwork, all her legal paperwork, everything had been taken, as Liz described before, in some type of sweep, or it could have been stolen. She wasn't sure. Stolen either way, I guess, is the bottom line. But I saw her mental health just depreciate just dramatically over the course of a year, to the point where I've been have lost touch with her. And, you know, I find myself looking for her when I drive and walk around in her old neighborhood. So yeah, so we can talk about accessory dwelling units and different types of housing and all of that. But the bottom line is people need support, and they need assistance. It's not just placing people in housing, it- and that would be a great solution. But again, you're looking at so many barriers to getting and keeping that housing. Like I said before, primarily race-based discrimination.
Somebody in the questions asked, what was the homeless population of LA County? It's about 66,000, according to the 2020 homeless count. And you can go on LAHSA's website and get a lot of details about the homeless count results, and that's lahsa.org, LAHSA.org. Someone said that they saw a news story in San Diego about a tent compound that probably like a big, solid, sturdy tent that included brand new bathrooms, showers, medical and mental health services, and security. And it somehow encompassed smaller tents. I'm sorry that I'm not familiar with the story that this writer is talking about. But I think that it dovetails with another question about camping. What do you all think about sanctioned camping, where you have tents in one place with access to bathroom facilities and that sort of thing?
John, you go ahead first.
No, go ahead. Go, Liz. It's
Well,
okay.
what I see is that, I mean, it's not great to live outdoors year round, but since people are going to be doing that, isn't it better that they have a tent, a sleeping bag, maybe some type of kitchen barbecue area they can cook in if need be? If we're not going to be able to provide the housing, we need to provide something and at least have sanitary, clean areas. The key is to make sure that you scale them properly so they're not overly huge. But I know it's controversial, and a lot depends on who is doing the camping and what the rules are and how it all works. But having the bathrooms, the showers, some type of way of cooking or barbecuing if need be, and ensuring people had a certain scale of tent, meaning, that there was it kind of has to be so you don't end up with these huge. I've seen some crazy encampments where there's just couches and all kinds of things like that around, and it would have to be really designed with people living there, but also to be careful not to make it into kind of a huge dumping place for other types of furniture and things. John, go ahead. You know more about too.
I think from a policy perspective, I feel about sanctioned encampments, in a lot of ways, it's kind of a race to the bottom. What can we do that's sort of fast and cheap and doesn't really require us to make the kinds of investments we need to in providing adequate, safe, decent housing for everyone. So I think, to focus on that as a long-term solution, I think is a bad idea. To Liz's point, and I think this is the push and pull that we feel in Los Angeles, is that we have this emergency that we've had for a long time. And I think COVID has laid bare, what we've been dealing, Angelenos, but we frontline service providers for a very long time. So the question is, we have too many of these either or conversations, right? Do we build permanent housing and then basically keep people on the streets and say you have to wait till you get permanent housing before we're going to do anything to help you? Or do we shift gears and we put all of our resources on the front end and we have sanctioned encampments and we expand safe parking and we do all these other emergency interventions? And my advocacy would be that I think you need to do both. It's not either or, it's and both. And, when you're talking about sanctioned encampments or safe parking, it's the management of whatever system is created or program is created to make sure that the people utilizing those services are being effectively served. So wide scale, sanctioned encampments where there isn't access to safe sanitation, garbage collection, where there isn't, an opportunity for that to become a public health hazard, is where the focus, in my opinion, needs to be. But I think long term, from a policy perspective and from an investment perspective in terms of infrastructure, we absolutely should be focusing our resources on things that bring people inside into safe, decent, and affordable housing. Because and unless and until we do that, we're going to continue to chase our tails. And I just want to, follow up on something that Chancela said. I said earlier that housing is the solution to homelessness, and absolutely is, but I'm not in any way suggesting that just sticking people in housing is a solution, because the fact of the matter is that people need a level of support in order for them to maintain that housing. We talk a lot about housing first, but in my opinion, it's housing always. So we're not doing anybody any great shakes if we move them into housing and then they get evicted, because what they needed was some additional family support. So I think that's the other piece of when we talk about permanent supportive housing, we're not just talking about a dwelling unit for people to live. We're talking about wraparound supports that are appropriate to that individual or family in order for them to not just survive, but to thrive.
There's several questions about NIMBYism and whether or not that's really the thing that slows down housing the most. I don't know if it slows it down the most. It does slow it down to a certain extent. But there's also several questions about, and they're directed at you, Liz, because you're Venice Family Clinic. If Venice Family Clinic has a position on the permanent supportive housing project that's planned, Lincoln Apartments, that would go up next to the Parish Hall of St. Mark Church, which is in an area where there's also a St. Mark school. And full disclosure, I've written an editorial about that. And there are many people, there are people who definitely support it, and there are many people who oppose it. I don't know if you want to comment on that at all, Liz.
Venice Family Clinic supports that housing. We have been involved with Venice Community Housing and Safe Place for Youth, which will be doing that housing. They are excellent not-for-profits who've worked in this community for many years. They will put up something that is of high quality and will work well in the community. And if for some reason something's not going well, they will respond quickly. I don't have concerns about it.
Okay. Is NIMBYism the thing that, how do you fight that? I mean, John, Chancela, anyone?
Well, I don't know that it's the only thing. There are an awful lot of obstacles in the financing and the permitting and all of that are certainly obstacles and add a lot of expense to housing construction. So it's not just NIMBYism. I mean, I talked about this before in earlier in the presentation, and I think, how do you combat it? And this is going to be wildly unpopular with some folks, but I'm going to say it. That I think that, part of the paradigm that needs to shift, the way it works now is a housing developer, goes to the elected and says, we want to build an affordable or permanent supportive housing project in your district in this location. And generally they're told, well, you go out to the neighborhood council or whatever the local community group is and you get their support. And once you do that, maybe I'll support you and maybe I won't. And so the developer goes out and gets spanked publicly, often many times in very not so pleasant ways, and kind of has to come, hat in hand, begging to solve the problem that we're all talking about today. I think that the narrative should be that the housing developer goes to the elected and says, this is what we want to do. And the elected and their staff go with the developer to the neighborhood and they say something like, we understand you have legitimate concerns about design, safety, security, all those things. Most reasonable people will have questions that can be asked and answered adequately. But let's be clear, at the end of the day, this project is going to get built and we're going to live together for a long period of time. So let's focus on your questions and concerns that we can address through good design and good property management, and all the things that affordable and permanent supportive housing developers do as a natural part of their business. If we did more of that, we would blunt a lot of the NIMBYism. As I said earlier, what we do now is if you show up and scream loud enough, if you send enough emails, if you file lawsuits, you often usually win. And so that just gets perpetuated, again and again in various communities. So I think one of the ways we could shift the tide is to have a different conversation up front, not put the developers in a position of having to beg, but many of these projects, frankly, could be built by right. And I know no one likes to approach anything with shoving something down somebody's throat, but at the end of the day, sometimes you have to press your rights in order to make change. And I think there needs to be more of that with our colleagues in affordable and permanent supportive housing.
And
if I can just add, today, I was trying to gather myself for today because I was watching the memorial services for Congressman John Lewis, and and this is what he spoke to is that it really is incumbent upon all of us to protect the smallest of us and those who are underrepresented and underserved and undervalued, frankly speaking, in this community and in this country, and to really take up that challenge on a personal level as well as he did, from a very young age, doing good trouble and so forth, and raising a voice. And he put out a piece today that was released today as really a call to action to everybody to speak out against injustices, and that includes the injustice of the lack of housing, and what leads up to the lack of housing. It's not just the person finds themselves on the street. It's because when they were a child, they were overly disciplined in school, put into incarcerated when they maybe shouldn't have been, maybe denied healthcare services. There's a lot of different things that lead up to that point, especially when you put race and compound race into that as well. I just really look at Congressman John Lewis as an example of what we could do.
This is someone wrote and said that they are a 19-year-old in Santa Monica, and what can she do to support people experiencing homelessness starting today? And what can she do long-term?
Oh, that's a great question. I mean, I would say volunteer, but that's very limited right now in COVID. But certainly, there are a few things she could do. She could organize, her friends and neighbors to do some kind of hygiene supply drive, to do a food drive, to do a clothing drive. Those are needs that, both our outreach team that we share with Venice Family Clinic needs for services to the people that we're seeing on the streets, as well as the Access Center. So, I mean, those are some very specific actions that can be taken, can be done safely. Those items can be gathered and then they can be, delivered. So, I mean, that's something I think very specific and very in real time that could be done.
Chancela, can people volunteer with your organization at all?
Yes, exactly. So in a couple of different ways. One, and it's not just a volunteer, we do pay a small stipend. We incorporate testers to go to apartments to see if they're being treated differently because of their race or their disability and so forth.
Great idea.
So not just apartments, it could be all kind of different living situations to see if they're being illegally discriminated against. So they can contact the Housing Rights Center if they're interested in being a tester for our organization. And that's anybody, regardless of race, religion, disability, because we need to have somebody who we think is the preferred person and somebody we think who they don't want as the person living in their apartment or wherever.
Carla, can I say one more thing about the 19-year-old in Santa Monica? If that person goes to the City of Santa Monica's website under the COVID response page, I believe there's also a link for other opportunities in the community locally that they may want to check out.
And her name is Lila. So yeah, go ahead.
Okay. I was going to add, we also give away food on Tuesdays at our site called Simsman Health and Wellness Center at 2509 Pico Boulevard. And that is one place that we are taking volunteers. We, of course, screen everybody and make sure you have the right mask on, but we need help in distributing food. seeing well over 800 people a week there getting food. They are not all homeless people, but they are people in need who need food. And we need help distributing that every single week on Tuesdays.
There were other questions. Oh, and somebody asked me how many participants were. I think at its height, there were about 290 participants. Thank you all so much. I learned a lot. This is so interesting, and I so respect all the work you do. Thank you everyone for participating and asking questions and listening. Thank you.
Thank you.
Thank you, Carla.
Thank you.
Thanks, Chancela and Liz.
Yeah, thank you, John.
John.
Liz.
A pleasure.
Thank you, everybody. Thanks, Chancela. Thanks, John. Thanks, Carla.
Thanks, Liz.
And Aaron and support staff as well. Thank you.
Great. Thank
The whole
you.
Venice Family Clinic team, awesome.
Yeah, we have a good team here. We
Awesome.
like working together. Thank you.
Yeah, they're great. All right, have a good day.
Thank you. Bye-bye,
Get
everybody.
into,
Bye,
go